Hi, Mark Jabin here, Medical Director for the Haywood County Health Department, and let's talk about this pandemic. Here we are again for the weekly update. Well, a most remarkable week it has been for Haywood County. Numbers increasing in some western North Carolina places, and the overall trends continued, but the Delta variant is starting to have an impact. So please share this with someone you care about. Across the country, no states in the red, only 2 states in the orange. Florida, with the highest rate in the U.S. now, but without any red counties, and Missouri, on the other hand, with significant red zone areas, although neither are really at rates that would match what we saw in January. In fact, both are just above the threshold for yellow. You'll see even more gray in the center of the country and the northeast, and some scattered green now in the southeast. For our neighbor states, the big change again this week is in Tennessee. You recall last week there was a big bump up with quite a few counties in the red zone. This week, dropping back well down into the yellow, and only 1 county in the red and a lot of green. Georgia down a bit more, and South Carolina now all yellow and more green. In North Carolina, average daily cases continue down, now to about 350 per day on average. Deaths are down to 10 a day average, but that's still 10 a day average. North Carolina now with just 1 county in the red, it happens to be here in western North Carolina, down to 6 in the orange, and 11 in the green, including 2 in western North Carolina. And in western North Carolina, you'll notice Macon slid down into green, joining Madison. Clay, unchanged and remains in the red zone as that only red county in the red zone in the state. Jackson and Graham with nice decreases this week. Graham now back into the yellow. But increases seen in 4 counties, Cherokee County, Swain, Transylvania, and Henderson. And note the total number of new cases in each county to get a sense of really what's going on around you. As far as testing, the important threshold, of course, is 5%. And you can look at North Carolina as well as all those counties in western North Carolina reporting now 2% or lower. Haywood County with the biggest drop this week from 5% down to that 2% rate. And for Haywood County, now 4,494 total cases for the entire pandemic. That's an increase this week of only 6 new cases. And you can see in the week-over-week change graph, this is something we've not seen since very early on in the pandemic, actually before the first spike last summer. No additional deaths reported this week. We remain at 101 for the entire pandemic in Haywood County. And COVID-related admissions at Haywood Regional Medical Center were between either none or 1 during the week. So what does all this mean? For Haywood County, what a week. As of Friday, there was only 1 new case in the previous 4 days. That means 3 days with 0 new cases reported, something not seen since the really early days. And this gets us well within the goal of 2 to 3 new cases per day average and less than 20 per week. If this holds, that would be fantastic. Other than Clay County, western North Carolina continues to be in pretty good place, pretty good shape, although we will have to keep an eye on the 4 counties that saw increases, some of those substantial increases in the number of total cases for the week. The Delta variant is gradually gaining traction around the country, which apparently accounts for much of what's going on in Missouri. It appears the vaccines are proving protective against it, but only for people fully vaccinated. 1 dose does not appear to be sufficient, a really good reason not to skip that 2nd dose. And a good reason to consider getting all of your family members vaccinated, as this may be the sign of the future. Communities with low vaccination rates most vulnerable to the variants. So if you're traveling, don't forget to check out the prevalence in the community you are headed to. GlobalEpidemics.org and the Georgia Tech Event Risk Tool are a good way to get a sense of how careful you should be. And see video number 160, and you can get that by YouTubing Daily Pandemic Update with Dr. Mark, for how to decide what you feel comfortable doing or not doing, vaccinated or not. Because there are still times where it's worthwhile to be careful, especially if you cannot be vaccinated, choose not to be vaccinated, or even if vaccinated, you live with someone who really cannot afford to get COVID. After all, there are still 10 fellow North Carolinians dying each day with COVID. And to their loved ones, this is still all too real. So be well and be careful, especially right now.